I'm really thrilled and delighted to be here, not only because I'm a former California resident, but because this topic has excited the passion and interest of the Stewards of Change Institute. And all of our board members are here because we believe in what's going on in this arena. But Daniel calls this an Ignite session, and that's, I admit to being a huge fan of metaphors, and I love the idea of igniting your further thought on this topic. It's our hope and wish that you'll leave here with a fire in your belly about open data and go back home to consider how you can play a role in making all of this a reality and following through on the promises that Dwayne just gave you about the promise of open data in the human services as well as health field. So I just want to set the stage for this, because one of the reasons for an Ignite session is to say to you that although you may have already gotten the message about the value of open data in your organizations and to yourselves as a citizen, there's an important point to remember that, first of all, you're not alone in the world, that many others have come to this same conclusion. And the second part of it, which is really what we're going to talk about in this session, is that there are tools to help you accomplish this. And there are very, very advanced modern approaches that have come about through the efforts of both government and industry to find innovative ways to deal with open data. I really, in line with thinking about this metaphor, it's really obvious that there are fires of change burning all over the world relative to this open data initiative. I had the privilege of speaking at a conference on shaping our global future in Trieste, Italy, in November. And the first panel, which was a very distinguished panel of academicians, public policy makers, had a very important topic for their assigned topic to open this conference of 500 people from 35 countries. And the panel just threw it out, said, we can't not talk about open data. It's sweeping Europe, it's sweeping the Americas, it's sweeping Asia. There are something like 169 cities and counties in the US that have already jumped into this world. And we have to think about it as people who are either practitioners or technologists in this field. Why is this? Why is there so much excitement? And what does that mean for me and my job as a concerned person, citizen, member of government or industry? Well, I think there are three winds that are blowing this fire and keeping it alive on a global basis, which I think we're going to address a little bit in this panel. One is there's this very, very positive, strong, pervasive yearning on the part of our citizenry for accountability and performance measures for government. You've seen that and heard it since you've been at this conference, people seeking new ways to measure outcomes, not outputs. People, society seeking to know where their tax dollars going, legislators wanting to base programs on evidence, not on anecdotes or seat-of-the-pants intuitive notions. So that yearning for accountability and performance measures for government is really global. Second, there's a very strong phenomenon that's also very global on the notion of citizen full participation in the process of government. There's some very interesting experiments going on in Europe right now where local governments in particular have invited the citizenry to participate fully in all the decision-making processes, right from the first point of defining a strategy for the delivery of health care or justice or law enforcement services, and to make citizens an open and consistent partner in making those decisions, but also in carrying out those responsibilities. Letting citizens know that government can no longer afford, or may not even be capable of solving all their problems for them, And as was indicated by Dwayne, getting the citizen more engaged in controlling things like data, but also taking responsibilities for some of the functions that we traditionally have levied off on government. So that engagement revolution is also sweeping the world. You can see the evidence of it in things like crowdsourcing and things like crisis camps that have swept the world to help respond to major disasters throughout the world, and other activities that are not necessarily even instigated by government, but are designed to help government solve some of the major social problems that we face today. And the third wind that's driving all of this is the technology. It's really, it's interesting to me to look back on the Obama administration. I remember when, in the transition period before Obama actually took office, there was a lot of consternation, as I'm sure you might imagine, in Washington about, well, what's going to be his hot button? What are the things I have to do to really respond to this new guy? That consternation and angst was evident throughout the federal bureaucracy, but also the companies that work in Washington wanting to know what's going to be the deal here. And it was very clear in the transition period amongst those who were watching this closely that his biggest thing was transparency, that he was convinced that government had to be more transparent and would be to the extent he could do so. It's interesting to note that President Obama recently acknowledged how limited the capability of the president is to really make change, but there's no question that any president can begin to express a tone that may get reflected in the work of the various departments that he was responsible for. And he got people cooking on this idea of data.gov. And it was a desire on his part, I say with some respect, maybe a little naive, but the idea that let's put all this government data that we've held to our vest out there for the public and people to do innovations and whatnot. I don't think he realized what he was really doing, or even his very bright, capable staff, because he was not aware of the coming explosion of things like big data and the fact of the widespread influence of things like geospatial analysis and predictive analytics and those kinds of tools. And it was because that notion of transparency and citizen engagement, and then the commercial development of extremely exciting and sophisticated tools for analysis took form and made open data and big data come together in something a lot more than just a dream. And we have today tools that'll just blow your mind if you haven't gotten into them. Technologies like Hadoop that have swept the commercial world and created the ability to analyze both structured and unstructured data in unbelievable new ways. And the recent RFP that was just issued by the government shows us that it's now possible to do things like continuous monitoring of large-scale information systems to detect cyber attacks before they can even get to the core databases. All kinds of new tools. And what we're going to talk about now is some of the application of these tools in how big data tools can be applied to this open data universe, and how with that capacity for analysis and understanding of the data, we can achieve some of the insights that Dwayne so eloquently described as the purpose of why we're doing this. I think there's a conclusion here that I would hope you'd go away with from this whole symposium, and is that this fire will not go out. It's too widespread. It will only grow. It will grow in the hearts and minds of people who are passionate and smart throughout the world to deal with these issues in a whole new way. I moderated a panel in Washington last week where 3 federal CIOs basically said, you know what, we're not going to have our own computer systems anymore. We're trying to figure out how to use cloud computing to do all of our work and to outsource those big mainframes and all those systems we've built. We're just not going to do it. There's a new day dawning and new ways of dealing with information technology that we're coming to. But I would urge you also to go away with some caution. You know, it's always been interesting to me that Australia has always had a policy of letting fires happen naturally so as to maintain the natural balance of the environment. And they've had some bad experiences from letting that happen. They don't put them out, they let them burn. In this country, we always rush to put a fire out immediately, whether it needs to be put out or not. But in Australia, they haven't done that. And the problem, though, is that when you do that, when you let fires grow without careful thought, sometimes they can backfire. There can be backfires that cause problems in your implementation. And there's a danger in casually using open data and big data without thinking through what problem is it that we're trying to solve. There's a tendency amongst some folks including some academics, to look at the correlations that big data can bring, for example, in healthcare data, and assume that the mere fact of correlation is enough to define causality. And the careful scientists, the data scientists, we heard about this morning, won't do that, but it takes some very good care to make sure that we don't jump too far ahead of our own needs. So with that as background, it's my privilege to introduce some very thoughtful technologists who are here not to toot their own company's horn, but to explain to you what some of these new tools and technologies can offer. Because we want you to leave with the idea that, assuming you understand and agree that open data is something we must all work towards, there are tools to make this happen. There are ways to look at data in new, exciting ways that will ignite the fire in your belly. So I'd like to start with my good friend Bill Davenhall, who is also on the board of the Stewards of Change Institute with me. And Bill, for many years, has been responsible for the health and human services programs at ESRI. This isn't in your bio in there, but Bill retired from that job at ESRI, and due to some management inadequacies, the CEO of ESRI brought him back to work and said, you can't do this yet. You have more to do for us. And Bill is also shares my passion for focusing our resources on children around the country. We joke about the fact that it's too late to save the adults, so we should be investing our efforts in children. And his passion for this work in this field is unmatched by anybody in the country. Bill?
Thank you, Paul. If you really expect a lot of great new ideas here about what great things we're doing with big data, you're probably going to be disappointed because probably the most important technology that's in this room is between your ears. Because what I'm going to talk about is something that we all possess, and part of it is curiosity, but part of it is why we're in the business that we're in, why we chose to work in the health and human services, whether we're from the technology side or whatever side of government we're coming from. So I'd like to say that what I'm going to talk about is this visualization of data is as much an art and inspiration as it is data and technology. I laughed, what is the biggest capacity you have to do big data analysis on your laptop? So I'll jump in there. It's an Excel spreadsheet that can take about 1 million rows, and then I'm out of luck, right? So anybody have TOS software on their machine that'll do 1 billion records? So you see we got a long way to go if we're going to essentially democratize the analytical part of big data. So with that, I would like to just have you focus on this eyeball. Because in reality, okay, it depends a lot about what we're looking at. And then it depends a lot what we do on what actions we take, what that eye sees. So, is that eye looking at down the road 20 years out and thinking about all the storms that are going to approach on the horizon and the problems that need to be solved? So we all have these things, right? We have this kind of equipment with us. It's called an eye. And we have to begin to visualize what it is we're really trying to do with big data and analysis. This is the problem we're in today. We've got so much of this swirling about us, we actually are paralyzed. We really don't know where to start. Now, are there plenty of problems to solve? You betcha. But we don't seem to want to take the time to stop and think about the problems that, first of all, might be solvable today with what we have today, and we don't have to worry about tomorrow. Or what are the problems that we need to begin to figure out how we're going to solve? It depends a lot on what you think you're building. So stop and think. What are you building? Are you building a system that integrates all the data that's ever been collected or ever known about a patient, a client, a customer? And so it depends a great deal whether you're going to live in a single-story ranch house in Southern California, or you're going to live in something like this that added to, this actually turned out to be a movie, but it's a play on words about the complexity of family life, that all these additions were put onto this building to accomplish something else other than just building the building. It was to accommodate the needs, the interests, and the inspirations of the people that lived in it. Here's the other thing. You know, obsolescence is no longer, debatable. I mean, obsolescence to me is like if it was invented yesterday, it's probably obsolete today. So, we're going to be in an era soon where there'll be just-in-time programming. You won't even have to probably go to school to learn how to do this. And everybody will become their own. There'll be citizens programming. Like I say, we have citizen EPIs now. We have people that go to the internet, they find tools like ESRI has, and they got data that the government provides. And the next thing you know, they're little Dookie Housers, right? So think about what trust it involves to both be the catcher of a kid and what kinds of confidence the kid needs to let go to be caught. Now here's an interesting example. This actually was driven by inspiration I got from listening to the health department director in San Diego, because they adopted a program of zero tolerance for stroke. When I first heard that, I laughed. I said, how's that possible? That's impossible. Well, it's not if you break it down and you have many hands in the labor, right? So I invented these billboards. Now anybody who would like this slide, I'd be glad to give it to you, and you can change the name to your city. And you can make outlandish promises like that. What happens when an organization at a community level puts a billboard up in that community? You certainly know what your job is in terms of data. You know what you have to analyze. You know what you have to measure. You know what you have to track. You probably even know who you have to target to make that dream come true, right? So sometimes by getting these visions in your head and communicating them effectively, it looks relatively simple, but you can imagine what lies behind that. Now here's the problem we have today. Are we ready? I mean, I like pancakes and I like the syrup. I got the tools, got the knife and the fork. I got the curiosity, but by golly, can that boy chew it all down? And the problem is this is the paralysis I speak about. So you can ride your own rails if you choose in the health and human services. You can stick to what you're doing today and you could ride down that rail, but somewhere down there in the middle, this is going to happen to you, right? You have a choice to make. Do I build the system that will allow that train to cross effortlessly and make it easy and so we don't have a train wreck, or am I going to stick to the rails that I've already been on for a long time and this is the direction we go, and I have to respond to program grant requests and I have to keep the program administrators happy. This is where we've been. This is how we like our life as data people, right? Everything, a place for everything and everything in its place. Except that pigeon can't find its hole at the moment, so it's kind of waving in the wind. The problem is this is what that new pigeon box looks like. It's going to be room after room of servers and wires, right? They call this the cloud, but the cloud isn't really in the sky. The cloud is in a building someplace. If you're going to try to explain that to somebody, that's like 95, about how that's really not a cloud. So this is where I say where you have to begin to let art and emotion begin to filter into your thinking about what you're working on. This is a map of the United States, and it has every single one of the toxic release inventory sites monitored by the EPA. Now when you look at that visually, does that create an emotion in you? And I would say if it doesn't, there's something wrong with you, right? Particularly those people who are east of the Mississippi. right? So each one of those dots, this data has been available since 1987. And I would say, how many people have ever touched it? How many know it's free? How many know they can get it from the internet today? How many people have integrated it with other information they have from their agencies and communities? A couple, right. So, you know, as we launch into this era of big data and analysis, my argument is we haven't plowed as good as we know how now. So we're already buying new tractors, right? If you're selling tractors, you're into that, right? Here's another novel thing. I mean, this is low birth weight babies. But here's a state agency who decided to start to use their birth records and look at them on a daily basis and make some decisions as where are the households that are producing most of these babies. Now, they knew they couldn't get out there really fast to help the baby that just got born. There's some things they throw into motion. What they wanted to know is where do we need to send the educators, the patient educators and the consumer educators to talk to teenage girls, because smoking rates are also high in these areas. Now, they were able to do this because the data existed and there was some technology available to make this happen. But I'm saying there was a reason why they wanted to do it. They just weren't out on a fishing expedition. How about these kinds of maps? These are called heat maps. This is where geographical information technology allows you to start to develop patterns. This happens to be walkability in a community. So you could see that town planners need to do a little bit more work there, perhaps. And here's, how about this map? Any emotion on that? We're talking about diabetes. Is there any mystery where we need to be working harder on diabetes in this country? I'm sure every community has diabetes and every community wants to work on it. But if you were president of the United States and you made it put up a billboard and said we're going to get rid of diabetes, you would know where you have to go first if you're going to win that war, right? Here's New York. New York State is one of the few states that publishes cancer rate data down to the zip code level. So each one of those red circles, the bigger the red circle, the higher the incidence of cancer. And they picked 5 cancers. This was a very contentious law that was passed in New York. It was upheld by the governor. And basically the health department either had to conform or they probably had to update the resume. But you're going to see more of this because the data is ready, the data is available, and only what I would call the disciplines of health science in some ways are retarding its advancement because they have all sorts of issues that deal with for statistical reasons. And I'm saying there's plenty of people on both sides of that argument, so it's not mine to argue that. How about this one? This is a brand new one. This came out of the Dartmouth Institute, and it has to do with the 100 drugs that Medicare says should not be given to somebody my age. I'm on Medicare, and this is about me. And the darker the red says that physicians continue to prescribe dangerous medications to seniors. And look at the place that's the yellow up at the top. Does anybody have any idea what community is up there? Pardon? Mayo Clinic, which has one of the lowest rates of giving seniors these risky medications. Isn't that, I mean, that's a mystery to me how that happens. No, it's not a mystery. I was joking, right? Okay. The problem is now, as a consumer, what do you do with that? Does that create emotion? Does this make you think that I might actually use this kind of data to figure out where I should live or where my health care might be endangered or, you know? And I say the answer is, of course it would. How about prostate cancer rates from the National Cancer Institute? That sort of makes me think things aren't random. How about Parkinson's? Oh, we could do this all day long. Hospital readmission rates. So while we talk in generalities, okay, we've got to learn how to use this technology to move to specifics. Because if we keep working in that generalities, I'm so sick and tired of watching the CDC set of slides that shows how America is getting fatter. You know the obesity set of slides? I know you've seen them. You know, Colorado was the only holdout that refused to turn dark blue. But I think they've turned sort of medium blue, right? They may be very blue here in a little bit, okay? Young adult mortality. Now what you're seeing is cluster analysis, okay, where the statistics were used in a very sophisticated way to really discern that there's places where young people are dying that shouldn't die, right? And so it forces you to look at the places where you need to head. Here's the most toxic locations in the United States over the last 25 years. That's where we've buried more toxic chemicals, much of it carcinogenic, in America. Now, I just happened to lay onto that map a map of the streams of America, where the major rivers are. Is there anything that pops out there? And then I said, oh, let's go get the aquifer layers. Let's see where we get our drinking water. And that's a map of aquifers, comes from another governmental agency. That's freely available. Well, let's put that together, and voila. Who's from Houston? Okay, Houston's got a huge reservoir of toxic chemicals over the last 25 years, and you can see the aquifers, right? So where should we be studying hormonal impacts or reproductive impacts, right? How about gun deaths after Newtown? How about how you feel? So this is a biomapping project in San Francisco where they hooked up mini lie detector machines to people in their cell phones, walked around the community looking at artwork and buildings and architecture, and measured their galvanic response, just like a lie detector. And where you see the tallest spike happened to be an intersection is very dangerous to cross. That's where all the anxiety happens. Now, if you're into mental health, you begin to think, how could we measure the mental health of our community on a daily basis? Well, here's an idea, right? I'm going to run through this because my time is up here. Here's what I would argue. First of all, pay attention to the workflows that your data systems are wrapped around. You probably can do a lot to get more value out of the data and the technologies that offer visualization. You probably won't have as much impact on the workflow. And the workflow would be like, just think of your doctor's office and what goes on in that office, who takes your card and makes a copy of it on the copy machine, and the nurse that weighs you and so forth. That's the workflow. And it's the workflow that really drives most of what goes on, right? So you can change the information and you can change your hardware and your software, but you also may have to look at the workflow. So my argument is, I better get to my argument. These are the data pipes we have today. One bucket at a time. Here's the data pipes we need for tomorrow. Nobody's really building those. This is the data we're getting today. Can you see that? I mean, it looks like anything you could ever want. Nobody's going to leave home before the data gets finished, right? Because we're always talking about that. And here's the saddest thing I would have to say that you have to be concerned about. This happens to do with geographic granularity. If you're in the health and human service business in the United States, about the best you can do with your data is either at the county level. There's a handful of data sets that are at the zip code level. And yet our Census Bureau is comfortable to work at the 9 million block level. So what is it they know that we don't know? Why are we forced to only work in 3,000 data buckets when there's 9 million available? So that's something to really think about, this geographic granularity. So there is more than one fork in the road. There's many of them. And all I can say to you is, hurry, grab as many as you can and get out of there because the car's coming. All right, these will be available on the website. These are the kinds of questions that has to come from the analytical explosion that we're seeing. You have to start to ask the penetrating questions that force your agencies to start to think about the workflows that are behind them. Why can't we know how many low birth weight babies were born where this morning? They were born in the last 24 hours. Why can't we know that? Someone needs to answer that question. And we need to figure out why we can't solve it. It's like, who said the lost child? I guess it was Dwayne. Is there any reason for a lost child in a Child Protective Service agency? And there might be an argument for somebody who says it is, but there's not. Here's Watson. Watson is one of our hopes. So that's a plug for my friends at IBM. I wanted to also tell you about one application here. If you go to the Apple Store and download an application, My Place History, you can load in all the places you've ever lived in the United States, put the street address in, and you'll get a report about how close you've lived to the toxic waste that I showed on that map. Okay? As you look at that, begin to think of all the other information you would like to also have on that report. Think about cancer, think about Parkinson's, think about all the things that you're concerned about as a human being, and begin to visualize what the system can do with this kind of data analysis. Thank you very much.
I
Thank you, Bill. We'll figure it out. There are a lot of innovative programs being developed to care for vulnerable populations in our society, and many of them are derived from the evidence that can be analyzed and created using the big data technologies. And one of the companies that's been most forward-thinking in this is IBM, and we're fortunate to have Walter Sedlacek, who's in product management for strategic purposes in IBM, and he doesn't know I'm going to say this, but there is a very fascinating seminar on the web put on by IBM on their strategic thinking for the long-term purposes of computing. And about 2 years ago, IBM really came up with a conclusion that these computers we've all bought are no longer just for accounting purposes. They're no longer just to do the payroll. They're no longer to just count things. But in fact, what computers are meant to do in this day and age is to provide insight. And this is a monumental change in thinking on the part of IBM, who, as you well know, basically invented this whole field. But to think about the purpose of computing and software to provide insight rather than counting things is a massive new change. Some of those programs are going to be mentioned to you by Walter as he talks a little bit about how the entire IBM Corporation has moved into this new stage of thinking.
Thank you, Daniel. Thank you, Vernon. Thank you to the Stewards of Change staff for the opportunity to escape shoveling snow in the cold weather, but also to be part of this conversation. You know, I think when Brian Sivak talked yesterday, I thought it was really interesting about, you know, kind of the evolution of how the federal government, and I think we see governments who are into open data are thinking about it. And that, you know, it's not the shotgun approach. Putting lots of data out there, even the Code for America guys talked about it yesterday as well. You know, it's really thinking about where the high impact, the high value use of that data ought to be. And, you know, when I think about this, I think in terms of use cases and a focus around people. So, you know, what I'd like to kind of put out there is this idea of where is the disproportionate spend occurring in our systems. And CMS came up with, their technical assistance arm came out with a real nice study this October looking at super utilizer programs. And I'm going to make the assumption virtually everybody in this room has a term, if not this term, for their high cost, high need clients and families that they're serving. And what's really important about creating impact in the use of data is to go where the money is, right? Because we're on a trajectory that's not sustainable. You know, healthcare, Medicaid, and states are 1/3 of the budget or more and continue to rise. So really thinking hard about attacking and addressing people in a proper way and providing data who provide that care, I think is vitally important. So, you know, so I'm going to use this as the basis to talk about some of the work and the use of data, and then hopefully get on to this video here. So these super utilizers not only are medically needy, right? They have complex health conditions, medical conditions, but as we heard yesterday from Esty and San Diego County, this whole idea of the social determinants. There's other things that these folks also have to address. And we know who they are. We know that there's high uses of, like Harriet with, in our personas yesterday, and emergency rooms or inpatient admissions. But those are kind of the indicators. Those aren't the root causes. And what's interesting about this study is by providing wraparound care and teams, costs in these areas of the ER and inpatient admissions and readmissions have gone down by 30 or 40%. And they're different. There's a common kind of model around wraparound care, but they're really focused on different populations, different vulnerable populations of people. And the study goes on further to talk about, data is the oxygen, but the people that are providing the care in a high-touch way and are wrapping care around people, and those interventions are the secret sauce. And that having a comprehensive view of people and the ability to put in the right interventions across not only the medical area, but also the behavioral health area and the social area is critical. And to be able to provide that data in a prioritized fashion and to do it in a timely manner and deliver it to the people that are most accountable. So, I'm a product manager, as Paul talked about, and I think in use cases and I think in requirements. So this is informative for us as we think about a reference model that we want to encourage and deploy and think about the use of data. And we're kind of thinking of it as a biopsychosocial reference model, to think about a person holistically across these domains and their core sets of needs and these social determinants, and focus on these high-cost, high-need, vulnerable populations. And Daniel talked about, human-centered design. And so our systems and our data, if we've got to start from that perspective and then be able to kind of enable capabilities around this core model, that is what we kind of are talking internally about and talking to our customers about worldwide, how to pull together this BPS model and then to deliver tools on top of it. So we're doing some work on the research side and around the area of vulnerability indexes. Okay, so how do you take this model across all of these spaces, and how do you start trying to calculate and provide prioritized information to stakeholders in care delivery around the functioning of their clients? So what you see here is what you'll see kind of coming up. But here's kind of a screenshot of kind of a proof of concept around the software that pulls data from a lot of different sources, both internal to the enterprise and external, to be able to look at these core areas of health, a person's education skills, their income capabilities, are they at risk in housing, what is their food and their safety. And in this case, it'll be about Bob Pugh, guy down there, the fine-looking gentleman down there on the left-hand side, and to look at not only those vulnerabilities, not overall, just overall, not only in those domains, but also what contributes to those vulnerabilities, and to be able to look at different sources, whether it's in the HHS enterprise, other areas of data in government, or open data that sits on the web, and combining those, and to be able to get access to both legacy systems, modern SOA-based systems, or kind of the emerging, semantic web, the web of data that's out there around linked data, and to be able to operate on different data types, the data sets that are provided, aggregate data and statistics that have already been processed and that can be brought into these models, further evidence-based or industry models, as well as subject matter expertise. So not only collecting the data, but providing a capability to start building out these models of vulnerability around these populations, and to be able to provide insight into thinking about how to provide better care and focused care for these high-cost, high-need clients and families, and to be able to look and see and score those vulnerabilities, and to have an ability to look at this dynamically, so as new data sources become available, to be able to look and see and react dynamically. Because as it said on the first slide around the super utilizers, I mean, they live a chaotic life. Things are constantly changing, and to be able to add new data sources and to seed data in a dynamic way and to update these models will be really important. So this example shows as we add additional data not only around the individual, but what's happening in the community, that can affect our view of the vulnerability of an individual and what might be driving that. And then taking a bit of Bill's page, thinking about the context of Bob and his family and how it relates from a geospatial standpoint. So these are all kind of concepts that we're working on and thinking about how we can pull technology together and demonstrate the power and the opportunity to get access to this data, open the data, whether it's in the internal silos or data that's been open for public use, and combining that. So in this kind of proof of concept idea, we're going to combine social and healthcare data out of systems so that we're able to see social care records, healthcare records, information that's held about the family, to go out to external domain-specific ontologies so that we're able to combine this data, these vocabularies that can define a common way of thinking about terms between, not only between different data sources. So you have kind of a roadmap, a taxonomy to correlate and have these data become more discoverable and automated. So as you build this web of data, web of information in these models, you're able to do it in a very flexible way. We're also adding government data around environmental and these kind of, the open web areas. So these are all areas that we're doing in this proof of concept. So before I start the demo, I got one more little sort of, kind of idea here. So what you're looking at is what's going on underneath the covers here. What we have is we have Bob, and he's represented. This is how Bob looks in a web of data, a set of linked data that's available in multiple systems and information sources. So the green, the green in the center, you see Bob down there on the lower right, and his relationships and information in the healthcare system. There's also a vocabulary or ontology around what healthcare data means, and that kind of that's Bob, as a patient and all of the conditions and information around that. Bob also exists in the social care system, and there's a vocabulary for that. And you can start seeing how this stuff is starting to interlink. There's also kind of, family-specific information in that social care system. And as we start thinking about families across systems and different household configurations, how can we create that? And then system-specific vocabularies, as well as thinking about open data in the universal ways of thinking about people, places, and things, and addresses, and things like that. Really what I think the key point here is thinking about what the use cases are for the data, and that there's capabilities and there's a reality about bringing all of this together. It's here, it's available, and it's a pretty exciting opportunity to think about how you can build these new models of care and data to enable them. Thank you.
Thank you, Walter. I don't know how anybody that lives in Dublin could be sick. It's such a beautiful town. But just for those of you who may not be that interested in the ongoing battles of technology, I assure you that the concept of linked data that Walter's talking about is going to have a direct impact on the way you build systems in the healthcare world. Linked data is a concept that's now been endorsed by the World Wide Web Consortium, and if you haven't read about it, it's worth asking Mother Google about it and reading a little about it, because it's a way, the whole notion there is to put the descriptors about the data along with the data on the web, so you can make these linkages, as Walter was demonstrating, without having to go through thousands of dollars of programming. It's already there and they're connected. So it has the potential to make the collection of open data much more useful and powerful in our ability to cross jurisdictional and disciplinary boundaries by collecting this data. So it's very exciting. And we thank you for introducing that. So our final presentation on the tools of the future for how things can be done better really addresses this whole issue of citizen participation. And as I mentioned earlier, a lot of the driving forces behind the move towards open data throughout the world have been the recognition that citizens have to play a more direct and meaningful role in the work of government and in the resolution and the provision of services. And that's been a strong motivation for the development of open data tools. And Socrata happens to be one of the companies that's probably the leading company in the provision of open data portals that have been introduced in many places throughout the world and growing very rapidly. They're not the only answer to this, but we've asked Ian Kalin, the director of open data at Socrata, to talk to you about how this can really impact citizen involvement, including creating jobs and opportunities for innovation by both industry and citizens. Ian?
Okay. Thank you so much. Again, my name is Ian Kalin. I'm the Director of Open Data with Socrata. And while I ask for help to advance the screen or switch it over to the slides, I realize I'm the last presenter before you all go to lunch, which sucks for me. But what we're going to do is I'm thankfully a fast talker, so I'll crash in a little bit and take advantage of the time we have. Actually, let me jump up here. To do, while we're changing the slides, a brief survey. So if I could ask you all to please stand up for me, if you would. Everyone please stand up. Folks already standing, stay standing. Don't invert me now. If you are 100% satisfied with your open data program, portal, policy, you would say this, my organization is doing great, one of the best in the world. Go ahead and please sit down. If you are you're just, okay, 95% satisfied. Okay, we got two people who sat down, they're doing pretty darn well. If you have an open data policy or portal or a central location where folks can engage, it's got some work to do. It's okay. Maybe it's moderately okay to up to that point of the perfection. So you got at least something. Go ahead and please sit down. So, oh wow, I expected a lot more than that. Okay, well, if you're a publisher of data, not just a personal data, but your organization really publishes data, go ahead and sit down. Let me get a few. Okay, I got a few more folks on that one. So the folks that remain, I think, are probably folks that don't really have a bit of this awesomeness, which has been on stage for quite a bit, and are looking for something to get started. So the 10 or so folks, thank you so much for being part of this open data discussion. Sit down now, thank you. I just wanted to get a sense of my audience to see how many pros we have in the room. Thank you. Brilliant. And how many folks want to do a whole lot more. So recognizing that, again, the lunch may or may not be to your port side, I'm going to do my best to go through some stories to exemplify, demonstrate how Socrata is working with people to help accomplish their goals, help organizations succeed, and ultimately to empower us to live healthier, more productive lives. And I'm going to put it in the context of the citizen experience, not patients, we'll come back to those, not doctors, but the average person, resident, maybe better than citizen. And I want to put it in the context of this widening gap in expectations. Most of you, this is a separate survey, I think I know the answer to this one, so I won't do a show of hands. Buy things on Amazon, make reservations for restaurants online, probably did some e-shopping for the holiday season. And so we recognize in our own lives, it's pretty easy to do a bunch of stuff that's really fun. And yet somehow when we engage with governments, I'll pick on them for a bit, or when we are engaging with doctors, it is really hard to do stuff that we can do every day elsewhere. And that is increasingly unacceptable. And the reason it's increasingly unacceptable is because our own capabilities, the technologies that are allowing us to live more productive, fun lives, are taking us to a level far beyond what most governments and what many antiquated organizations are currently capable of delivering. That may have been fine for quite a bit, but the pace of data being stored, the exabytes that we heard about earlier, the pace of technology innovation the rate is increasing, which means that that line, basic math, that line's going to go higher faster. And the problem is that so many of the institutions that we engage with, we receive services from, the governments that we vote for, the taxes we pay to, they are not innovating nearly as fast as that citizen expectation for basic services. And so you have this widening gap. The funny part is that with our perspective at Socrata, we're seeing more and more how everyday folks, businesses, researchers, doctors are taking this not just to improve their own lives, but the lives of those around them. I was going to tell a story about service delivery as brought up by the president, but you had Brian Sivak, you had your iTriage slide about 20 minutes ago, so I'm not going to tell that story. I'm going to tell a more personal story. I'm going to disagree with Paul a bit. It's the panel, right? So we have to interact, not just share. This is my first debate, the first debate on the panel. Paul, I disagree with you. I do believe the president knew quite a bit about what he was going to do with open data, about how transparency was going to achieve things. And I can say that with some evidence because I had the privilege of serving on the president's technology team. I was one of the president's presidential innovation fellows. And I saw how entrepreneurs are transforming this wholesale resources, this open data, into products and services of real value. And I'll give a personal story. Sometimes, though, it's shocking how much cannot be done. So this is my personal story. I'm a new dad. And I'm like many other new dads. I live in going to my newborn class, all excited with my wife. And one of the slides talks about the rate of car seats that are installed incorrectly. Okay, I'm an engineer. All right, so wrong car seat installation. I got it. Get a list of resources from the National Highway Transportation and Safety Administration, NHTSA. And it was 10 locations in my neighborhood where I could call to inspect my car seat. Okay, so I'm looking at this. Okay, I'm going to call that. Okay, I'm going to go this weekend. I'm going to get it inspected. Every single number, address was wrong. All of them. Now, in my unusual level of access, I did something that most folks can't do. I called the Secretary's office of the Department of Transportation, and I said, come on, man, update your damn list. And they did, and lo and behold, I was able to get the correct and certified inspection for my car seat. How many people couldn't do that? How many people have been to that website and didn't happen to have the unusual level of access that I had for a brief moment of my life? It is unacceptable that so many folks didn't even know that the list was wrong. I found out later, they published it for 2 years, never updated it. How many folks have been to that class and were frustrated enough to not even realize? This is unacceptable. And folks are trying to help, but don't actually have the means to engage with the publishers, say, it's a bit outdated, or lo and behold, if you're the iTriages and the businesses of the world, say, we really want it in this format, and by the way, I want an application programming interface. I want to API this data so that I can get it in real time and then integrate it into my products going forward. These types of data silos, now I'm going to disagree with Bill a bit. No one's connecting the pipes. I humbly disagree. I think that there's a great example of health data being connected in New York State. And in the interest of time, I will rapidly accelerate this story. So New York has been featured by Dwayne and others, actually, in terms of their health data innovations. Recently, there's a really great story, really inspiring. Again, I'm a new family, right? So I'm thinking of all these child programs. There was a map that showed childhood obesity rates, overlaid with other information about how much money is being spent on school lunch programs and high school graduation rates. Lo and behold, there were a few hot spots. Similar heat map. There were a few hot spots in New York where some schools had an unusual level of childhood obesity. Here's the cool part. The publishers kind of knew a bit of this data, but it was the parent-teacher associations who organized and told the state government, this is unacceptable. I cannot have my child go into a school where an unusual number of kids are suffering from childhood obesity. Here's the data story for this particular audience. The data wasn't state data, it was county data. County data was integrating to state level on a state portal, breaking down data silos, breaking down the traditional roles of government. No, I'm a county supervisor, not the state administrator. Who cares? The people need the data. They don't care where it comes from. And that's actually working in New York. So I humbly propose that the 58 counties in California could replicate the type of success coming out of New York. Here's another example of, well, hopefully again for the super data users, of some opportunities. How many of you have heard of open access? Open access, scientific research. We got about 10-ish folks. Cool. So good news. If you're here, you're probably some type of a data geek, or you like people that are data geeks. The federal government had a new rule. If you're a federal agency and you are getting over $100 million worth of money to spend on R&D, all of the research projects, all the data from that scientific research must be made public. And just like data.gov was a revolutionary piece of transparency, science.gov, which feeds into data.gov, more data is going to be available in the next few months than any of you in the research field have probably ever seen before. The data already existed, you just couldn't get it until that publication made it a new rule, new law. And by the way, they have a little, for those of you in the research community, there is a qualifier on it. It cannot be made public in its wholesale form for about a year. That allows you to win the Nobel Prize. Don't worry, you can still win the Nobel Prize. But after that, you got to make the data public. And I'll close with my third example. It was actually brought up in terms of these high users. This is in my hometown of San Francisco. Anyone actually here from the San Francisco government? I saw Cindy on the attendance list, but I think she may not be here right now. Okay, I'm not going to steal her story, but I'm going to advertise it a bit. San Francisco is one of the first open data cities, one of the first open data governments, and they've had some time to test it. We see a lot of times that the best open data portals are not just bring information out to the public, it's breaking down those internal silos. In fact, at Socrata, about half of our data exchanges are within government agencies, not public. And a lot of that's even just for privacy controls and lots of other essential issues. But that showcases and makes possible this type of use case. Actually, I don't know if you can see it in the back, but it's an example of a high user study. Basically, you take all the people that interact with the county healthcare system in San Francisco. And of course, there are lots of silos, right? There are lots of different departments. You have the substance abuse, you have the emergency room clinics, you have the preventive activities, and they are only concerned with their individual budget lines, because it's government. That's the way it works, right? And so what they wanted to do is get a horizontal cut. Every single agency, how can you figure out who the super users are, even if individually there weren't necessarily any red flags? And so if you were to lay out all the different costs per person on a one giant line, you would see that from the 0 to 95% of the people, excuse me, the average person only consumes about $1,700 worth of services in a given year, about 2.5 services per patient. The top 1% average $97,000 per person with 89 services per patient. I saw that. I'm not in the medical industry. My background's in energy. I saw this and I went, how? How is it even possible? And then you start looking into some of the details. Of course, they were redacted in terms of their person identifiable information. And you see things like 8 ambulance visits a day. You're like, oh, okay, well, that kind of, all right, I can kind of get to that number. But lo and behold, the funny part about when this study was made public, $49 million also happened to be the amount that the San Francisco budget was short in terms of having a balanced budget. But literally, the 1% was allowing the government to be, solvent, I guess. And so, what does this all mean? These hopefully, we'll call it hopefully an icing on the cake of the wonderful, inspiring stories you've heard up until this point. My last point here, I'll close with, especially in this neighborhood in California, we can do more. I found that the most compelling thing is always success. You see something that works, especially in government and a lot of the healthcare industry does not always want to be the first adopter. I get that, I respect that. Well, good news for California at the state level, I'll say this in Sacramento, you're not the first. Not only are there states that have done some fantastic programs, but even in California, you have cities and counties that are really pioneering extraordinary levels of health data innovation. They are creating jobs while lowering the cost of healthcare, helping link the right hands to the right people at the right time. And so my call to action, I'll just close by saying, we need to do more in California. We need to do more at the state level to leverage this type of brilliant experience, expertise, and results into something that can transform all of our different experiences into something that helps us accomplish those common goals for health and human services.